You are live. You may start when ready.
Yes, thank you. Hello, I'm Doug Chafee, the Chairman of the Orange County Board of Supervisors and your 4th District Supervisor. Thank you for joining us for our second The OC press conference. Before we hear from other speakers, I want to briefly discuss the Emerald Fire in Emerald Bay, which is a county unincorporated area. At 4:10 a.m. Thursday, February 10, a vegetation fire broke out in the area of Emerald Bay and extended into the wildland. As the prompt response, no injuries or damage to structures have been reported. We thank the Orange County Fire Authority and the local fire agencies for their swift and continuous work to keep us safe. Today we are hosting the press conference at the old Orange County Courthouse in downtown Santa Ana. It was built in 1901 when Orange County had a population of about 20,000 people. As the oldest courthouse in Southern California, the old courthouse has been used as a filming location for many movies, including Legally Blonde and Catch Me If You Can. The building is on the National Register of Historic Places and is a State of California historic landmark. It contains the Orange County History Center, which includes Old Courthouse Museum, the Orange County Archives, and the Library of the Pacific Coast Archaeological Society, as well as government offices. One of those offices is the Orange County Clerk Recorder's Office. Yesterday on Valentine's Day, along with Vice Chairman Don Wagner and Supervisor Christina Foley, had the pleasure of marrying couples both online and outdoors in person. In one online ceremony, we had 31 people participating online to celebrate with the happy couple. Last October, I was able to marry my youngest son right here in this historic courthouse. And my father, who was an attorney, practiced law in this very courthouse years ago. Today I've invited the Orange County Clerk Recorder, Hugh Nguyen, to highlight some of the great and innovative work his department has been doing, especially with marriage ceremonies. We're very great to have the best clerk in the entire nation right here. Very fortunate. Additionally, we'll receive an update from Doug Beck, our Director of the Office of Care Coordination, regarding the Everyone Counts OC point-in-time count. Lastly, Dr. Chow, our County Health Officer and Director of the Orange County Health Agency, will provide a COVID-19 update. At the end of the press conference, the media can ask questions about these topics and anything else of concern. Again, I appreciate all of you for joining us today, and welcome Clerk Recorder Hugh Nguyen to the podium. Thank you.
Thank you, Chairman Chafee, for giving me a chance to talk a little bit about our office. Yesterday was a fun day. I want to thank the board members, Chairman Chafee, and also Vice Chair Don Wagner, and Supervisor Katrina Foley. I hope you enjoyed doing the virtual yesterday, Doug, because I love the picture that you sent us. And so it was an exciting day. A lot of coverages. It's a happy day. It's the most romantic day for our office ever. And so our staff, we do amazing work, making sure the couples leave happy. And that's important for us. And so I'm very proud of our department. Last year, we won the NACO Award, and also we won the prestigious CSAC Award for the Urban County for Hitch at the Honda Center, which was a simple idea we had, but I didn't know it was going to turn out to be so big, nationwide and even countrywide. And so we were spreading love instead of spreading the virus. So people were enjoying their time coming to us. We were doing around 200 ceremony a day at the Honda Center. And it was a simple idea in a ticket booth. We dropped at the Honda Center, and I didn't know it was going to blow up so big. But that was an amazing award, and we swept the CSAC Award and the NACO, and I'm so proud of our staff for accomplishing that. And so our biggest day coming up, believe it or not, even though it's Valentine's was big, is the 2/22/22. It's a special day. You'll never have that day again. And so I've been looking at the stats for appointments, and it's been fully booked for over a month. And so we're going to extend the hours because I want to make sure all couples are able to come to us and get married, and also do the candle light at night from 6 to 8 again. And so if you're wanting to get married, visit our website, ocrecorder.com, or call our number, 714-834-2500, and we will take care of you. We're going to be open that day. And so I just want to thank Chairman Chafee to give me a chance to talk about our department. And thank you so much. And I would like to introduce Doug to the podium.
Good afternoon. I'm Doug Becht, the Director of the Office of Care Coordination. Next week, we will be conducting the Orange County Point in Time Count, which will take place between Monday, February 21st to Thursday, February 24th. The federal government, through the U.S. Department of Housing and Urban Development, require that each jurisdiction conduct an census of those individuals experiencing homelessness in their community at least once every 2 years. The federal government and our state government utilize the data from this count to determine allocations of funding and resources to our community to help address the homeless crisis here in Orange County, making conducting an accurate and thorough point-in-time count incredibly important. The point-in-time count, what we call Everyone Counts OC here in Orange County, consists of two parts. The first part is a count of those individuals experiencing homelessness in the shelter. The second is a count of all the individuals experiencing unsheltered homelessness, meaning they're either living in the street, in a car, or any other place not meant for human habitation. This second part of the count, the unsheltered portion, is where we need you as a volunteer to come help us out. The unsheltered count provides us with 6 opportunities to volunteer. This portion of the count is conducted over the course of 3 days with 2 sessions each day, one in the early morning and one in the late evening. As you can see on this slide, we focus on a different portion of the county each night. Tuesday, February 22nd, we'll be canvassing our Central Service Planning Area or region. Wednesday, February 23rd, we will be counting our North Service Planning Area or region. And Thursday, February 24th, will be in the South Spa. Each region/service planning area will have 2 deployment sites where volunteers will report to and volunteer out of. There are 3 roles one can volunteer for. The first, the field surveyor. That's our most common role. The field surveyor goes out in teams of 3 to 5 to help conduct the survey, surveying all the individuals they come across, but specifically those that appear to be experiencing homelessness. The second role is the team captain. The team captain is also a part of that 3 to 5 person team, but they take the lead. They're often individuals that have participated in the point-in-time count previously. They're willing to take the lead role of their team, helping their team members make sure that they're filling out the survey correctly, covering the whole geographic area they're responsible for, and being the main connection to their deployment center. And finally, for those that are unable to or uninterested in going out into the field, there's a volunteer opportunity to be part of our setup and cleanup team. Those volunteers either come to the deployment centers before the count occurs and helps set up, or they come after the count and help clean up. Unlike the team captains and field surveyors who are expected to show up to their site from 4:30 a.m. to 9 a.m. if they volunteered for a morning shift, or 6:30 p.m. to 11 p.m. as those who've signed up for an evening event. The cleanup and setup teams have a much lower time commitment to their volunteer activity. All of these options provide plenty of opportunity for individuals to volunteer. With this being an in-person event, our top priority is the health and safety of everyone involved. The health and safety of the volunteers, our staff, and most importantly, the people we're surveying. We've worked very closely with our public health department and our county health officer, Dr. Chow, and are requiring that each person participating in next week's event provides either proof of full vaccination status, meaning if you've received a 2-dose vaccine over 6 months ago or a 1-dose vaccine over 2 months ago, that you will also provide proof of a booster shot. One can also provide a negative PCR test that has been conducted within 48 hours prior to your volunteer shift. All staff and volunteers will be required to wear face masks throughout the duration of their volunteer time, regardless of vaccine status. So finally, I want to provide you with the website and social media accounts that will lead you to our registration form. EveryoneCountsOC.org not only provides you with the registration form, but also useful updates and resources for the night of the count. This is a truly unique opportunity to volunteer and serve your community. It allows you to help engage and help your neighbors experiencing homelessness in a unique and impactful way. So please go visit EveryoneCountsOC.org, sign yourself, your family, and your friends up. We're excited to see you next week. And at this time, I'd like to introduce Dr. Clayton Chow for the COVID update.
Thank you, Doug. Good afternoon, everyone. My name is Dr. Clayton Chow. I'm the current County Health Officer for Orange County, as well as the Agency Director for the Healthcare Agency. I hope you can hear me okay. Over the past few weeks, we have started to see cases in hospitalization decline. And on this slide, you will see the number, although we made the last set of slides this morning, I'm giving you even more updated number since then. So our positive cases have decreased to a 7-day average of 1,042, with today reported around 702 cases. And our adjusted case rate has decreased to about 29 per 100,000 cases. Our case positivity has decreased to 7.3% overall, as well as the positivity rate for the area that are most vulnerable population. You probably know it as referred to at the equity metric. So our equity metric is even at 7.3%. On this next slide, you can look at the hospitalizations, which has dropped to about 431 currently for the adults, with 74 of those adults in the ICU. And for the pediatric population under the age of 18, we currently have 22 kids in the hospital and 3 in the ICU. And overall, 74% of our eligible population of people at the age of 5 and older have now been fully vaccinated, and over 80% have had at least 1 dose. And one of the metrics that you've heard me talk about that I'm most proud of Orange County, and that is the senior over the age of 65. In Orange County, senior over the age of 65, 99.9% have seen 1 dose of vaccine. Let me repeat that number. 99.9% of our senior in Orange County over the age of 65 have gotten 1 dose. And about 93% are fully vaccinated. So 93% of our senior over the age of 65 have been fully vaccinated. That is a number for us to be proud of. And so I know that there's a lot of entities that have worked together with the county, the health system, the pharmacy, the community clinic have really been driving this effort. So thank you so much for all their work. All of these numbers are positive signs that our most recent surge is slowing down, not only here in Orange County, but throughout the state and the nation. As you may know, thanks to the declining in COVID-19 cases and hospitalization, the state has revised its guidance for the use of face masks, effective tomorrow, February 16. Universal masking will only be required for certain settings. So let me repeat that. So the universal indoor masking will change. For the general public, if you are unvaccinated, you continue to require to wear a mask indoor, anywhere, any setting in public. But if you are fully vaccinated, you don't have to, but we strongly recommend those of you who are fully vaccinated continue to assess your own risk. If you yourself or you live with a loved one or a friend or a family member in the same household that are high-risk population, meaning people who are immunocompromised, people who get sick very easily, then we strongly recommend that you continue to do so, to wear a mask. But for the general public, you don't have to. There are some exceptions, such as healthcare settings, a high-risk concentrated area like the shelter or a jail, and also K-12, the indoor universal masking continue to apply beyond tomorrow. I know there has been some talk about that issue, especially for K-12, and those of you who attended or view the California Health and Human Services Secretary, Dr. Mark Ghaly's press conference yesterday, he announced that the state would continue to analyze the COVID data for another 2 weeks before sharing any new guidance on masking for our K-12 school. Studies indicate that there is still much to learn about COVID-19 and the long-term impact it may have on people's health. And in addition to getting vaccinated and boosted, masking is one of the most effective ways to reduce the risk of infection that we know so far. I think we all can completely agree that protecting the health and well-being of our students and staff is the most important thing, especially those who are vulnerable. We are encouraged that the state is studying the science, and we are also hopeful that the possibility of ramping down the mask mandate as transmission levels decline. So you have heard of February 28th. That is the date that the state is going to announce the transition, a future date where the mask mandate for K-12 will be changed to a strongly recommended measure. But please remember that a local health officer cannot issue a guidance that is less restrictive than the state. Let me repeat that I've gotten a lot of questions on how come you don't do this and you don't do that. Is per my jurisdiction as is related to CDPH, the California Department of Public Health, and the CDC, Center for Disease Control and Prevention, a local health officer cannot issue a guidance that is less restricted than the state. So we will have more to talk about on February 28th. So with that, thank you so much for your time, and I would ask Chairman Chafee to come up to start our Q&A session.
Thank you, Dr. Chow. At this time, we'd like the media to have an opportunity to ask questions. Operator, may we have the first question?
Thank you. For those not already in the queue, press 1, then 0 for questions over the phone. From Voice of OC, Nick Curda, please go ahead.
Hi, thank you all for taking questions again. I had some questions for Doug about the point-in-time count and homelessness. I was wondering if you have enough volunteers for the point-in-time count in terms of numbers? How many volunteers do you need? How many do you have so far? We're also wondering in terms of how people will be counted, wondering how people enrolled in Telecare and Oasis in temporary placements they cannot afford will be counted in the point-in-time count. If the numbers of homeless people are up in the point-in-time count, is the county considering reopening Project Roomkey as long as it's federally funded? Wondering as well how people in temporary home key placements are being counted in light of the county closing one of those sites. Whether CalAIM will have an impact on point-in-time count numbers. And lastly, there's been a big increase in homeless deaths in Orange County over the last few years. Again, last year was a big increase as well. I was wondering if your office has been looking into what is driving that and what you're seeing as drivers of that increase in death.
Thank you for that question. It's in multiple parts. So, Mr. Beck, would you proceed, please?
Absolutely. I'll try to answer as many of the questions as I can, and if I need to be reminded, that's great as well. So we currently, as of about an hour ago, we have a little over 525 volunteers signed up. Ideally, we'd like to get between 600 and 800 volunteers, and we feel really optimistic that we'll reach that goal. The question in regards to how people will get counted in other settings. So I had mentioned that the point-in-time count takes place between Monday the 21st and Thursday the 24th, but the unsheltered portion just happens Tuesday, Wednesday, and Thursday. So on Monday is when we conduct our shelter count. So any facility that HUD qualifies as a emergency shelter or one that should be counted through this count is working with our office and our project leads to ensure that they are doing their census that night. In terms of folks counted at the home key sites, so currently the county is working with the city of Stanton and Jamboree Housing Corps to develop 2 home key sites in Stanton. They're currently operating as interim housing sites. So those 2 sites will take part in that Monday night shelter count. And then I believe the last piece was about the work that our office is doing or considering around homeless deaths. So our office is obviously extremely passionate around serving those that are experiencing homelessness and understand that there's many stakeholders involved in addressing the many different issues around physical health, primary health, substance use, and mental health. And we are working closely with our county partners and our providers to ensure that we are giving the appropriate support services to the individuals that are experiencing homelessness. Did that cover all? Okay, thank you.
Thank you. Then for additional phone questions, please press 1, then 0, and please limit your questions to 1 per time in queue or time constraints. And our next person is, again, Nick Gerda with Voice of OC.
Hi, yes, for some reason this audio cut out, so I wasn't able to ask again. So the other question I had was on deaths. If you've looked at what's driving the increase in homeless deaths in Orange County, what you're seeing so far, and also wondering how people can sign up to volunteer for point-in-time counts, and whether it's now a reduction into 1 night per area of the county versus 2 nights last time.
Mr. Beck, you're on again.
Do you mind stating that first question again, please?
1 moment for Mr. Gerda's line to be reopened. Please go ahead.
Hi, can you hear me?
Yes.
Okay, yeah, the first question was on, again, on deaths. If you've looked into, or your office has looked into, what's driving the increase in homeless deaths that we've been seeing steadily over the past few years.
Yeah, we're working closely with the Sheriff's Department and our Public Health Office. And after I answer your question about the point-in-time count, I'll let Dr. Chow, our Public Health Officer, speak a little bit more about that. So I believe your second question was about volunteers with the point-in-time count. Individuals can, or volunteers can sign up. There's sort of two deadlines that one needs to hit. If you're interested in being a team captain, that would be you need to sign up by Friday night. Friday night is the last. There's a virtual training that team captains are required to take. And if you're interested in the other roles, you could sign up as late as Sunday night. And please go visit our website. It's everyonecounts.oc.org. All of our social media handles are very similar in the Everyone Counts OC, so pretty easy to remember. And you'll see all of the resources and information there that'll help folks sign up. One other point I'd like to clarify is that there are 6 opportunities, but individuals are allowed to and expected to sign up for 1, 2, or 3. It's not a requirement to sign up all of the days. And then finally, to your question about the one change in methodology between 2019, or the one significant change of methodology between 2019 and 2022 is that we are counting, instead of in 2019 where we did it over the course of 2 days, and each one of those days we canvassed the entire county. Now we'll be doing it over the course of 3 days, with each day focusing on a different service planning area. We believe our methodology with having a unique identifier will allow us to make that transition and still have apples to apples results, allowing us to have accurate measurement that we could measure against 2019.
Thank you. Then from KTLA, Chip Yost, please go ahead.
Oh, hey there. This is for Dr. Chow. I was wondering, since the newest mandate went into place for the mask on December 15th, has your office received any complaints about noncompliance, and has any enforcement action been taken for noncompliance?
Thank you so much for that. We have received a complaint from the community, and on the average, we receive about 10 complaints a day or so on the non-compliant in the restaurant setting and what have you. And what we've done is our environmental health team would contact the restaurant and work with the restaurant, reminding them of the requirement as is related to the indoor universal mask mandate. But remember, we are not the enforcement agency, so from what I've been told, that most of the restaurant, when we contact them, appreciate the phone call and said that they will try their best to be in compliance. So far, since the indoor mask mandate has started for K and 12, we have received a complaint from the community as is related to school, where there are students who not compliant to the mask mandate, or the school, and mainly the private school, are not following the guidance. And what my school team from the communicable disease school unit have contacted those schools, and we have so far a very high compliance rate. Usually it's because somebody don't follow the guidance, or they post something by mistake and then they change that. There's only one school, though, where we have to report to the state because we did not get a response from that school, and that is a private school. And immediately the state response team sent a letter, a pretty strong letter of warning to that school, and they have CC us on the letter. So we know that's happening. So thank you for your question. But I wanted to respond to the previous caller or a press caller on the question about death in the homeless population. As you're probably aware, when we look at our data for the last 5 years, there has been an increase in death among those who experience homelessness in Orange County, which is no different from other county. And most concerningly was that last year we was up to about 396 cases. We are working very closely with CalOptima, which is the health plan for people who eligible or do have Medi-Cal, and we believe that a majority of our individuals who are experiencing homeless are individuals either qualify or have Medi-Cal as their insurance. So we are currently working very closely with CalOptima on a project which on a later day we're going to come back and make the announcement on that project. And the project's aim is to increase access to care and respond to care for those who experience homelessness. The goal of the project is really to get people to the right care at the right place at the right time, and not having people have to wait until they're very sick and then they utilize the emergency room. And most of the time, when they get to the hospital, they utilize the emergency room as a place of care, the condition is worse than if there been appropriate care for them, meeting where they at. So we are creating a new pilot project that we're going to be rolling out together with CalOptima very soon. You might ask me, well, what did they passed away from or they die from? We're working with the coroner's office, as Doug pointed out, to look at the cause of death. And I can tell you there's some myth, right? There's some myth that people who are experiencing homelessness dying from COVID a lot. In fact, when we look at our data for last year, out of 390 some people, there's less than a dozen people who passed away from COVID-related illnesses. So I just want to make sure that I dispel that myth. But we've been working with the coroner office to look at the data and see what are the causes of death, ranging from homicide, suicide, to accidental death, to a chronic health condition, and we should have that data soon. Thank you so much for your question.
Thank you. Then, as follow-up, we'll reopen the line of Nick Gerda, and anyone else, it's 1, then 0 for questions over the phone. Nick, your line is open.
Hi, yes, I had a follow-up question for Dr. Chow for when that analysis will be available. It's been a few years now, lots of press coverage of it. So wondering what date we can expect the findings on, at least preliminarily, on what's been driving the increase in deaths. And then lastly, just one more follow-up. The question I had for Mr. Brecht on separating out the days for the point-in-time count. If there's a risk that people will move or be moved from one area to another during the count, that risks people being double counted or missing from the count if they're sort of shuffled from one area to another.
Yes, Dr. Chow.
Thank you, Nick, for that question. Yes, we're going to look at the cause of death, and when we roll out that program that I talked about, we'll probably give a baseline and the data as is related to, what a cause of death, because that program will speak to the approach that we will carry out in getting people into care. So, great question, Nick. Yes.
And when would that be?
So we are preparing. I don't know if it's going to be 4 weeks or 8 weeks, but we're working closely with CalOptima to roll that out, Nick, so I don't have a set date yet.
Thank you, Nick Gerda. So the question about spreading the time out, and is that going to open up the potential for people changing where they're staying from one night to the other, and creating a duplication in the count. We are instituting, which we utilized last time, a unique identifier. So essentially, when we go out and survey someone, a decent amount of the survey asks specific identifying questions, non-intrusive or questions, but things like, can you provide the first 2 letters of your first name and last name, and a few numbers after that will allow us on the back end, if for some reason we do survey someone twice, that there's a very high likelihood we'll be able to identify the duplication in surveys. To sort of back it up as well, we also ask individuals when we go up to them, hey, have we ask them if they've been surveyed before. And then finally, when we go out on the 22nd, 23rd, and 24th, we're not surveying these individuals asking if they are currently experiencing homelessness. We are asking them about their housing status on Monday night, February 21st. So, so if we come across an individual on Tuesday, we will be asking them, can you tell us about your housing status on Monday night? If we come across an individual on Thursday, we'll also be asking, can you tell us about your housing status on Monday night? So there's a handful of validated, unique identifiers that have been proven to really reduce the likelihood that we will be duplicating our count on any individual.
As operator, may we have the next question, please?
There's currently no one in the question queue.
Okay, then if I may wrap up a little bit, I believe Dr. Chow was referring to the Cal Optima Street Medicine Initiative. I think the plan will come out soon and it'll be operational shortly after that. We are very concerned about the mortality rate among our homeless population, and we want to go to them while they're in the street and give them the care that they may be missing. And that's, I think, the point of the street medicine initiative that we're trying to undertake. The county has done numerous initiatives, Tool Belt, Room Key, Home Key, particularly concerned with Home Key, which is competitive. We have, these are motels that can be converted into good housing with wraparound services. Have two already completed in the city of Stanton. It's my understanding Stanton has a third candidate, that Anaheim is looking at 3 potential sites. Costa Mesa has one, Huntington Beach has one. The other day I was chatting with a Fullerton council person. They may have another one. Funding is competitive. The word from Stanton, it's more than just providing housing. It's helping to cut down on other incidents of crime. Their police reports are much less. It's cleaning up the area around where the revitalization is occurring when we convert one of these old motels to something very useful. I also like to mention we have the Orange County Housing Finance Trust. A week ago, Monday, we put out a new request for proposals. We're trying to get as close as we can to our initial goal of providing some 2,700 units of affordable housing with wraparound services. We're well on our way to that. I think we're reaching past 1,500. This new RFP will get us even closer. And we're also asking from the legislature $30 million to help us finance more housing. So I'd like to thank all of you for coming here today. I hope you heard the statistic that Dr. Chow gave you, where 99.9% of our seniors age 65 and older have had at least one shot. That is why if there's another surge, we can contain it even better. That's a remarkable effort by our county staff and our other partners out there giving the shots and inoculation and keeping us all safe. So thank you all for coming here today, and we're going to do another OC press conference Tuesday, March 1 at 1 p.m. A location to be determined. We're trying to highlight different parts of the county, so the location will probably be in a different spot. So thank all of you for attending.